Okay. Dr. Neal Banard. Dr. Neal Banard is an MD. He's also he's a fellow of the American College of Cardiology. You're going to hear me say also a lot because he's an amazing person. He's also an adjunct associate professor of medicine at the George Washington University School of Medicine in Washington, D.C., and he's also the president of the Physicians Committee for Responsible Medicine. And he's also a singer, songwriter, and musician who created that song that we tried to show you tonight. It's called Louder Than Words. His group is called Carbon Works, CARBONWORKS, and I encourage you to go look it up and listen to the music. Dr. Barnard, though, has led numerous research studies investigating the effect of diet on diabetes, on body weight, and chronic pain, including a groundbreaking study of dietary interventions in type 2 diabetes that was funded by the National Institutes of Health that paved the way for viewing type 2 diabetes as a potentially reversible condition for many patients. Dr. Barnard has authored more than 90 scientific publications and 20 books for medical and lay readers, and is the he's the editor-in-chief of the Nutrition Guide for Clinicians, a textbook made available to all U.S. medical students. As president of the Physicians Committee that you can see on the screen, Dr. Barnard leads programs advocating for preventive medicine, good nutrition, and higher ethical standards in research. His research contributed to the acceptance of plant-based diets in the Dietary Guidelines for Americans. In 2015, he was named a fellow of the American College of Cardiology. In 2016, he founded the Barnard Medical Center in Washington, D.C. as a model for making nutrition a routine part of all medical care. And tonight, Dr. Barnard you can click the slide, JJ. Dr. Barnard is on tour promoting his new book, Your Body in Balance. It's a terrific book with a strong message. And if you haven't already purchased a copy, I'd strongly recommend, and I have great faith that after you hear this presentation tonight, you will be ordering it either from the local Barnes & Noble store or Amazon or wherever else you would like to, but make sure that you get it. So with no further ado, let me introduce our honored speaker tonight, Dr. Neal Banard.
Well, thank you so much, Ross. It's a great pleasure to be with you today. I have to say, I wish I could be with you in person. Circumstances have kind of conspired against us, but technology has allowed a new door to open when another one has closed. So thank you for allowing me to be with you today. I thought what I'd do is I do want to talk about hormones and their amazing effects and the surprising finding that foods can dial them up and dial them back and give us tremendous power. But before I do that, I'd like to talk about the pandemic because food plays a big role there as well. And if you don't mind, I'm going to share my screen with you, and I'm hoping that you could see that. Okay, did I succeed?
Yes, you did.
All right, very good. It will not surprise you that the vast majority of people who develop this disease and who end up having a very bad course, meaning you end up in the ICU or it becomes a fatal illness, the vast majority are people who have had some kind of underlying medical condition, either obesity or hypertension or diabetes, lung disease, heart disease, something like that. And this goes, by the way, let me mention for anyone who's having difficulty seeing the screen, if you're a little bit new to Zoom, you can minimize the pictures of me and so forth. You just move your little cursor up there and you can hit the minimization thing and you'll be able to see the slides a little bit better. Okay, when the disease first erupted in China, as you know, that was where everything started, right around roughly New Year's, an interesting pattern came up. And that's that if you looked at who ended up having a real problem, let's say you take everybody who ended up going to the hospital with this disease, how many had a bad outcome? where they ended up in the intensive care unit or worse. And among normal weight people, it was 19%. Among overweight people, it was 29%. Among obese people, it was 39%. So the heavier you were, the worse you did. The surprise was that underweight people, whom we had thought, well, you know, you're frail, you don't have enough body weight, they actually did the best of all. So we're starting to realize that thin is in when it comes to this disease. Now, don't get me wrong, I'm not promoting anorexia, but what we really want to do is to, if we're dealing with overweight or obesity, as so many people are, to get on diet changes that help us to solve that. And I'm going to be talking much more about that in a bit. And then right behind the obesity issue was the question about diabetes. And this is from Hubei province in China, looking at more than 7,000 individuals. Of those who did not have diabetes, the mortality from COVID-19 was 2.7%, but those who had diabetes, the mortality was much higher, 7.8%. However, if we go further and look at these data, let's zero in on the people who happen to have diabetes. They've all got a diabetes diagnosis. If they were in poor control, meaning their blood sugar was chronically high or their hemoglobin A1C was high, their mortality was 11%. But if you had diabetes and you got COVID, but you happened to be in good control, meaning your blood sugar tended to be in the right range and your A1C was not high, mortality was not 11%. It was about 1%. So how are we going to get there? I want to share with you our understanding of the cause of diabetes and how it can be controlled and even reversed. And I want to take one slide to do this. And if you pay attention to nothing else in my presentation, please let me ask you to pay close attention to what I'm about to tell you over the next minute or so. I want to share with you the cause of type 2 diabetes. Diabetes means that insulin is not working right. It's not doing its job. Insulin, as you know, is a hormone that's made in the pancreas. It travels through the bloodstream to the cells of the body, and its job is to get glucose, sugar, into the cell. So this cell, for example, this could be a muscle cell. It needs sugar to be powered. So there's the sugar. It's called glucose. Those little pink dots, those are the glucose molecules that need to get inside the cell to power it. How are they going to get in there? They have to get through those funny little purple doorways to get into the cell, but they can't get through. That glucose cannot get in the cell. It's going to stay in the bloodstream until insulin comes along. The insulin made in the pancreas, traveling through the bloodstream, arriving at the surface of the cell, just like a key in a lock. So that those little keys, I'm going to call that insulin, and those little red locks, that's the insulin receptor. So the insulin arrives, it attaches to that receptor, and it signals those channels to open up. And now the glucose can enter the cell. And that's great because it can power the cell. If you have type 2 diabetes, you've got glucose, you've got insulin, you've got those receptors, everything is normal. So why is the insulin not working? It's not working because of those yellow blobs that you see. That's fat. Beef fat, chicken fat, fish fat, cheese fat, olive oil, extra virgin olive oil, all kinds of fat come from our foods, go through the bloodstream, they pack into cells, and the more the fat builds up in the cell, the less that glucose, that insulin is able to work. It's a little bit like if some neighbor kids pulled a prank on you and they put some chewing gum in your front door lock while you were away. And you get home, your key isn't going to open the lock. There's nothing wrong with your key, but your lock is jammed with chewing gum. You don't have chewing gum inside your cells. What you have inside your cells, if you have type 2 diabetes or pre-diabetes, is fat particles inside your muscle cells. And the same is true in your liver cells. So if I can get that fat out of your cells, if we can remove that fat, we have a chance of reducing your medication use and maybe even getting rid of the medications altogether. And if we're lucky, getting rid of diabetes altogether. So how are we going to do that? Well, we're going to get rid of animal products because if I can make you into a vegan, there isn't any animal fat left. And if I keep the oils really low, that fat will dissipate. How do I know that? Because I can put you in an MR scanner, magnetic resonance scanner. If you ever had an MRI, you know what I'm talking about. Except we call it MR spectroscopy, where I'm looking inside your muscles and I can see that fat go away when I make the diet change. That's right. You'll notice I haven't used the word carbohydrate. That's not the issue. The issue is the fat buildup inside your cells. Once I get rid of that, your diabetes can improve. Okay. By the way, doctors hate words like fat because it has only 3 letters. So we'll call it intramyocellular lipid, which sounds more scientific. It's just fat inside your muscle cells. Okay, so a healthy approach to diabetes or to hypertension or to weight is fruits and grains and legumes and vegetables. What are legumes? Beans, right? Beans, peas, lentils, foods that grow in a pod. So we put this diet to the test with funding from the National Institutes of Health. We compared a conventional diet to a plant-based diet. And to just cut to the chase, what we tracked was hemoglobin A1C, which is a measure of blood sugar control. And the red line here is the people on the conventional diet. They did very well. They had a drop in their A1C of about 0.4 absolute percentage points. Very good. That's about what a drug would do. The blue line is the people on a 100% vegan diet, no animal products, and keeping oils low. As you can see, that blue line has a drop that's 3 times better than the conventional diet. So we have revolutionized the approach to type 2 diabetes. As we did so, one of our participants was named Vance. Vance joined the study, and he told me what diabetes meant to him. He said, I got it all up and down my family tree. To me, diabetes means you probably go blind, lose a leg. He didn't want to have this. We started him on a plant-based diet, and within about a year, he lost about 60 pounds. And I asked him how he was doing so well with it. He said, because this is the easiest diet I've ever done. Now that surprised me, because you think of a vegan diet as being a challenge. He said, no, you don't know what kind of diets people with diabetes have to follow. Count carb grams, count your calories, go to bed hungry every night, da, 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 da. He said, you don't make me do that. You just say, instead of meat chili, have bean chili. Instead of ground beef sauce on my spaghetti, put the tomato sauce on my spaghetti. Instead of the meat taco, have the bean burrito. How hard is that? Anybody can do that. You make some shifts. You don't ever go hungry. You lose weight automatically. He was able to stop his diabetes medications, and his A1C dropped from 9.5 to 5.3. Now, if any of you know about these A1C numbers, that 5.3, that's normal. When I got Vance's blood tests, I paced around here in my office for about 10 minutes to try to decide, could I tell Vance that he was cured? Because he was on no medications for diabetes. His A1C was in an absolutely normal range. And I knew that he could go into any clinic in the world and they would not diagnose him as ever having diabetes. Now that was a momentous time, but that was about 2 decades ago. Nowadays, of course, we can laugh about it because we see diabetes go away all the time. We now know that diabetes is not a one-way street, it's a two-way street. By the way, when I was asking his permission to share his experience with you, he said, make sure you tell everyone that my erectile dysfunction went away too. Okay, let me talk about blood pressure. Blood pressure makes COVID deadly as well. Back in the late 1990s, 1997, a study was done called the DASH study. You've probably heard of it. Dietary Approaches to Stop Hypertension. 459 people, they were asked to do 2 things. Increase the fruits and vegetables and reduce meat and fat. And let me show you what happened. The first thing we track is systolic blood pressure. That's the top number. If your blood pressure is 120 over 80, systolic is the 120 number. So the top line you're seeing here is people who didn't do anything. The middle line is people who ate more vegetables and fruits, but that was it. The bottom line here is people who ate more vegetables and fruits and reduced meat and reduced fat. And their blood pressure dropped brilliantly. And this is their diastolic blood pressure, the bottom number. In both cases, when you increase the vegetables and fruits and you reduce the fat and meat, blood pressure drops. But the most important thing about this is, it doesn't take long. This was an 8-week study, but blood pressure dropped within 2 weeks. So what does this have to do with COVID? If you've got obesity, if you have diabetes, if you have hypertension, you are a sitting duck for mortality from this disease. Most people in North Carolina, in the whole Eastern Seaboard, and in all of North America have not yet been infected with this disease. The virus is still waiting on the horizon to attack their community. We have more than enough time now to adopt a diet that is going to help us. Now, we still want to wear our mask. We still want to socially distance. We still want to wash our hands. We still want to be smart and careful so that the virus doesn't get us if we can avoid it. But if it does, we want to make sure that our body is strong. And that means tackling these conditions to the extent we can. That doesn't mean we have to eliminate our hypertension or diabetes for forever or completely. We'll do the best we can. But if we make big enough dietary changes, it is astounding what you can accomplish. And for many people, these are completely reversible conditions. Okay, for extra credit, let me just throw in a few other issues really quickly, starting with garlic. Researchers in England brought in a group of volunteers, and they separated them into two groups. 73 got garlic, 73 got a placebo for 12 weeks, right in the middle of cold season. So why are we looking at colds? Because colds are a virus. And in the placebo group, you put it all together, there were 65 colds, and in the garlic group, only 24 during the whole 12 weeks of it. Sick days in the garlic group, 111, but in the placebo group, 366. So it looks like, this is not the COVID virus, but this is a cold virus. It does look like something about garlic is helpful. Stay tuned. I have to say, when you see studies like this, I think it's important to be a little bit skeptical. It was a very good study. It was a large study, and it was very well controlled. Even so, it was funded by people who were involved in selling garlic supplements and things. So I think it's important to maintain a little bit of skepticism. The good thing about it is garlic is totally benign, and you can try it yourself. Okay, the next thing, let me talk about back to weight. I mentioned obesity being a big problem. We've known this for a long time. 2009, the H1n1 influenza epidemic began in the United States. And in California, it was noted that half of the people who contracted this infection were overweight, seriously overweight, obese. And we've seen again and again and again that extra body weight makes us vulnerable to infectious viruses. But it may not just be fat on our body, it may be fat that we eat. Researchers have found that high-fat diets impair white blood cell function. When I say white blood cells, I'm talking about the cells that are patrolling your bloodstream, looking out for viruses, looking out for bacteria, looking out for cancer cells. The white blood cells can engulf them. The white blood cells can make antibodies to destroy them. But your white blood cells cannot function in an oil slick. Now, some white blood cells are called natural killer cells. They really do shoot first and ask questions later. And researchers have tried a variety of experiments, feeding high-fat diets, dripping fat into the bloodstream via an IV, or doing this on the lab bench where you're mixing fat with the cells in a test tube. In all these cases, fatty foods and fat preparations interfere with white blood cell activity. It's good to cut the fat. It's good to cut dairy products, and this is especially true for people with lung diseases. And of course, COVID-19 is a respiratory condition. But let me mention about dairy because people have been really looking at it with asthma. There was a study done in children who had asthma. All the researchers did is they didn't give them a medication or anything. All they did is they took out the dairy and the eggs, that's all. And they found that their peak expiratory flow rate, their ability to breathe out normally, improved by 22%. Many other people have found the same thing. If you have asthma or know someone who does, if you have a child or grandchild with asthma, run, do not walk to a completely plant-based diet, and you would be astounded how often the child is able to not use their medications. They're doing much better. Now, asthma is a dangerous disease. Don't throw your medications away, but see if it doesn't improve when people make a diet change. Okay, vitamin C, vitamin D, zinc. These are vitamins and a mineral that have been tested. Just real quick, vitamin C, it probably does help. Vitamin C was really publicized by Linus Pauling, the California scientist who won not one, but 2 Nobel Prizes. He was taking 18 grams of vitamin C a day at the end of his life. A much more modest dose was used in an English study, 57 elderly patients with lung disease, and just 4 weeks on a very modest dose of vitamin C, 200 milligrams a day, led to a significant clinical improvement. So vitamin C, I suspect although the data are mixed. I suspect that some vitamin C every day is going to be good as a virus preventive. Vitamin D normally comes from sun on our skin. It also can be a supplement. And in a meta-analysis combining the results of 25 trials, vitamin D supplementation did reduce respiratory infections a little bit by about 12%. However, when you look at those people who actually tended to be really low in vitamin D, these are people who weren't getting sunlight, they weren't supplementing, and in them, the supplement made a big difference. It reduced the risk by about 70%. So vitamin D, good for your bones, probably reduces the risk of cancer, might help us also with regard to respiratory health. Finally, zinc. Zinc has been studied a lot, and in this study at Wayne State University, they brought in 50 people, middle-aged and older, and they gave them zinc gluconate for 12 months, and they did have a significant risk in infections. However, a word of caution, zinc is something that can be very helpful if you're not taking it and you start. But if you are overdosing with zinc, it can be harmful. What do? You've probably at the drugstore seen Cold Ease. That's the commercial brand for zinc, and it's used not when you're healthy. It's used at the first sign of a cold. And then you follow the instructions. When the cold is gone, you stop taking zinc. I think that's probably a smart way to do it. Okay, with that, let me shift gears. I'd like to talk about hormones, if I may. I was sitting here at my desk, and the phone rang, and it was a young woman named Robin who told me that she could not get out of bed. And the reason was that, like many women, she had menstrual pain every month, but like maybe 1 in 10 women, her pain was so severe that she just couldn't function about 1 day every month. I asked her to describe it, and she said, this is like torture for me about 1 day every month. So I made a suggestion to her that I don't think any doctor had probably ever suggested to a patient before. I said, let me give you painkillers for today and tomorrow. But for the next 4 weeks, let's do an experiment. Let's do an experiment with diet. I have to confess, I was simply making an educated guess. The guess was as follows. Menstrual pain is caused by estrogens, female sex hormones, welling up in the blood, causing too much of a thickening of the endometrial lining of the uterus. And if there's too much estrogen in the blood, there's too much thickening and too much pain at the end of the month. And researchers have been concerned about estrogen not because of cramps, but because of cancer. Estrogen fuels breast cancer growth. And so researchers had found that if you increase fiber in your diet, that's beans, vegetables, fruits, plant roughage, your estrogen level will drop into a safer level. If you cut the fat, animal fat, vegetable fat, if you cut the fat, estrogen drops into a safer level. So I thought, well, what are cramps? It's an estrogenic condition too. Maybe the same diet will help her. So I said, how about this? The next 4 weeks, no animal products. Everything you eat is going to be a plant, high in fiber, very low in fat. And keep the oils low too. And she called me back a month later and said, this is miraculous. Her pain it didn't occur. She had a period, normal period, no pain whatsoever. So we then hooked up with our colleagues at Georgetown University, and we did a study. We brought in a group of women who had pain every month. Half of them went on the diet that I described. The other half went on a supplement that was actually a placebo. After 2 months, they switched. The diet group started the supplement group started the diet. And we tracked their pain and PMS symptoms, and I have to tell you, it worked. We published the findings in Obstetrics and Gynecology, a journal, and in a nutshell, pain intensity diminished, pain duration diminished, and premenstrual symptoms diminished too. Now, in the course of this study, we asked all of the participants not to be using birth control pills or any other hormones. If they were sexually active, we asked them to use some other kind of contraception because what we were studying was the effect of foods on their hormones, and if they were taking hormones, that would goof up the experiment. One of the participants in the study said, Dr. Barnard, you don't have to worry about me. I don't take hormones. I don't take birth control pills. My husband and I gave up the idea of having a baby. she said that she and her husband had been evaluated for infertility. It's not him, she said, it's me, I don't ovulate, so we don't use contraception. We don't use the pill, don't worry. Well, the second month that she was on the low-fat, plant-based diet, she came into the research center and said to me, Dr. Barnard, I've got some bad news and I have some good news. I said, what is it? She said, I'm dropping out of your research study because I am pregnant. Yes, she was pregnant. And I ran into her about, maybe 8 years later. And she had 3 children at that point. Here's what I'm getting at. The first patient had menstrual pain. That's a condition doctors call dysmenorrhea. It's written on their chart. The second woman had a condition called infertility. That was written on her chart too. I take my number 2 lead pencil, turn it around, and I use my eraser to just erase those diagnoses because what these are symptoms of being out of balance. Okay, hormones are out of balance. What are hormones? Hormones are instructions. Hormones are made in one part of the body. They go through the blood to another part of the body where they give it instructions. They're like letters. Now, there's such a thing as not having enough hormones. You could have too much hormones. Imagine if you never got a letter in the mail and you don't know what to do. Or you get too many and you just can't deal with it. Either way, I'm going to call that hormone haywire. So let's go back to the first patient I described who had menstrual pain. This is the amount of estrogen in a woman's body during her reproductive years. At the beginning of the month, she has very little estrogen in her blood, but as you can see, it rises to a peak and then it falls. She's ovulating now, halfway through the month. And then for the week after that, the amount of estrogen starts rising again. And that's because the uterus is the most optimistic organ in the body. Every month it's convinced we're going to get pregnant this month for sure. So the estrogen level rises to thicken up the inner lining of the uterus in anticipation of pregnancy. But after about a week, the disappointed uterus discovers we're not pregnant after all. And so the amount of estrogen falls and the inner lining is washed away in menstrual flow. But food will change this. If you're on the wrong kinds of foods, you're making more estrogen and that can create problems. So this is the uterus in the middle. Off to the side are the ovaries connected by the fallopian tubes. So every month, that inner lining, that little pink lining you see, that's the endometrium, it thickens up in response to estrogen. That's normal. But what if I wasn't eating in such a healthy way? I'm not getting my fiber, I'm getting too much fat. Then what we see is that lining thickens up too much and it causes pain. It creates chemicals called prostaglandins that really hurt. So I need foods to help me get my hormones back in balance. How am I going to do that? Well, job one, let me draw a lesson from Catherine. Catherine grew up in Louisiana. She was an Air Force aerospace engineer, and she was one of the first soldiers to go into Iraq in 2003 because when she was over there, she was building the bases. And when you're in a war zone, you're working hard, you're not eating particularly well, and you're not eating a lot of food, you don't gain much weight. But when her tour of duty came to an end, she came back to the United States and her friends took her out to eat and they decided to make up for all the things that she hadn't had while she was over in Iraq. And the foods that she missed the most, cheese, mac and cheese snacks, all kinds of cheese stuff. In fact, for her birthday, a friend knew she loved macaroni and cheese, gave her a complete case of 48 boxes of macaroni and cheese, which Catherine ate every day for 48 days. She gained weight. But she also started to develop pain in her abdomen. And it wouldn't go away. It persisted and it was worse and worse and worse. And finally, the doctor did a laparoscopy. That's, you look inside the abdomen with a small tube. The doctor said, I know what you've got. You have endometriosis. That's a condition where the lining of the uterus appears to release cells that now sneak out the fallopian tubes and they implant all around the abdomen. They cause severe pain, and because they can attack the fallopian tubes and the ovaries themselves, they cause infertility. This was her situation. She tried a variety of medical treatments, including hormones. Nothing worked. The pain continued, and it got to the point where she was unable to function. Her doctor said, I've got one other solution for you. Let's just take everything out. Let's do a hysterectomy. We'll take out your uterus, we'll take it all out, your endometriosis will be gone. Except that Catherine was 27 years old, and she and her husband hadn't started a family yet. So she had to think long and hard, but her doctor said, look, you're probably infertile anyway as a result of the endometriosis. You got nothing to lose but your pain. So she scheduled the hysterectomy for 6 weeks later. But before she could have it, a nutrition expert told her about the diet changes and how they might help her, the kind of diet that we had been using. And she put it to the test. She threw out the animal products. She kept the oils really low. She was eating vegetables and grains and beans and fruits. And she started to feel better. Not 100% better, but a lot better. But when 6 weeks arrived, she dutifully reported to the hospital for her hysterectomy. They put her on the table. The doctor began to do the laparoscopy because you can remove the uterus through a small tube. The anesthetist put her out. An hour later, she woke up. She was in the recovery room, and the doctor was there. He said, I need to talk to you, Catherine. When I looked inside you with the laparoscope, I could see that the endometriosis had gone away. You still had some adhesions. You had a lot of scarring. And because of those adhesions, you had continuing pain. That was the pain that you were left with. I removed those adhesions and you should be fine now. But the whole endometriosis process that caused all this somehow has gone away. Well, her mother was with her in the recovery room, and her mother said, Doctor, she went vegan. Well, the doctor said, stop it. Foods do not cause endometriosis, and there is no way that any diet, including a vegan diet, is going to make this go away. If the endometriosis disappeared, that is just a miracle. I think miracle is written on a chart somewhere. Well, I have to tell you, I'm going to give the doctor some credit for not taking out her uterus. That's good. But I'm going to ding him because he didn't understand how diet affects hormones. By the way, there's Catherine today. She lost a lot of weight, and she has 3 children. She wasn't infertile. She still has her uterus. She no longer has endometriosis. She doesn't have any pain at all anymore. She joined us to be one of the Physicians Committee's Food for Life instructors to help other women take back their health. All right, so I mentioned she loved cheese. And I mentioned she had a hormonal condition. Does cheese have hormones? Yeah, it does. Cows are impregnated on every dairy in the world every year because when the cow is pregnant and gives birth, they start making milk. And if you keep them pregnant every year, they keep producing milk. And when they are pregnant during their 9-month pregnancy, they are milked during much of their pregnancy. And they are producing estrogens. A pregnant cow makes estrogens that gets into their blood plasma and it gets into the milk. And the longer their pregnancy continues, the more estrogen is in their milk. What I am saying is every glass of milk you ever had has estrogens in it, female sex hormones that are a match for yours. Every bite of yogurt, every bowl of ice cream, and especially every slice of cheese had estrogens in it. That's right, there is no hormone-free milk. And this can affect not just women, it can affect men. Researchers in Rochester, New York, looked at men in a fertility clinic, and they found that those men who tended to eat very little cheese, half the serving per day or less, had better sperm counts. Those who ate more cheese had lower sperm counts. So those traces of female hormones in cheese, they're only traces. But because your average man or woman eats about 37 pounds of cheese every year, plus milk, plus ice cream, plus yogurt, plus butter, you're getting estrogens from the cow that affect your fertility. They affect your health in a variety of ways you never thought about. Okay, men, don't go to sleep. I got one other thing I have to say to you. Men go to the clinic. They say to the doctor, Doctor, I'm having trouble raising the flag. The doctor knows exactly what he's talking about. He's got erectile dysfunction. So the doctor writes out a Viagra prescription. The patient grabs it and runs out the door and says, thanks, doc. At that point, the doctor drops his pen, runs out behind the patient, tries to catch him before he goes down the elevator and says, stop. We are not done. I need to talk to you. They go back into the exam room and the doctor explains to him that erectile dysfunction is not caused by performance anxiety, it's caused by narrowed arteries. You've been eating animal products, meat, dairy products. The cholesterol, the saturated fat in these foods cause the arteries to gradually narrow. They narrow in the arteries to the man's private parts. That's why he has erectile dysfunction. But while they're doing that, they are narrowing in the arteries to your heart and the arteries to your brain, which means that a man with erectile dysfunction in midlife has a higher than average risk for a heart attack or stroke within the next 3 to 5 years, and Viagra doesn't treat that. So the patient says, well, now, doc, you got me scared. What do I do? The doctor says, you can take Viagra tonight if you want. It won't help your heart. What you need to do is get the animal fat and the cholesterol out of your diet, do a completely vegan diet. And what you're going to discover is that your heart will be healthier, your brain will be healthier, your risk of a heart attack is going to go way down, but your erectile dysfunction will likely go away too. Okay, wild. Well, what else affects our hormones? Let me share with you about what fiber will do. Your liver, the liver, that's the red blob here at the top. It filters your blood every minute of every day, and it pulls estrogens and excess testosterone out of the bloodstream. It sends it down that green bile duct into the intestinal tract. If fiber is there, it carries those unwanted estrogens away. But if your lunch was chicken breast or salmon, those don't have fiber. So without fiber, the estrogens are reabsorbed into your bloodstream and they go back up circulating around again. Your body can't get rid of them. That means you have too much of these dangerous hormones in your blood, ready to cause cancer or other mischief. The answer, a high fiber diet to help you eliminate them. So I want to make sure everyone's paying attention. Spam, fiber or no fiber? What do you think? Spam? All right. Well, I got some spam and I got a trash can and I'm going to put one in the other. Good. How about KFC? Fiber or no fiber? Well, there's a little fiber if you eat the carton, but the chicken itself, no, sorry, that's got to be gone too. And there are some foods that started out as plants, but they became sort of unrecognizable and the fiber's all gone, so we're going to get rid of them too. All right, you got it. Cramps, endometriosis, infertility, they won't kill you. Breast cancer can kill you. Let me share with you this. These little dots, those are estrogens, estrogen molecules. They go into the cell. This is a breast cell. They go right through the membrane. They go in through the nuclear membrane and they can attach to your DNA inside the cell. And when they do that, a normal cell can become a cancer cell. It splits into 2 and then 4 and then 8 and then 16 and it can spread throughout your body. The more estrogen that is in a woman's blood, the higher her risk of developing breast cancer, especially postmenopausal breast cancer. So we want to have a high fiber diet, a low fat diet to tackle this. We want the dairy out of our diet. A new study just came out earlier this year from California showing that milk drinking women have 50% higher risk of breast cancer compared to other women. Why? Estrogens are the most likely reason. Okay, let me shift gears. I want to spend just a couple of minutes on the healthy thyroid, and then we can pause and talk about whatever you'd like. Your thyroid gives you energy, and your thyroid is at the base of your neck, and if you don't have enough thyroid hormone, you're going to be hypothyroid. You're going to be low energy. You'll feel weak. You'll feel sensitive to cold. You'll feel constipated. You'll probably gain weight. Your mood will be low. Well, your skin isn't even going to be healthy. Your hair won't be healthy. The opposite can happen where you're hyperthyroid. You've got too much thyroid hormone. And the symptoms are kind of the opposite. You're losing weight. Your pulse is rapid. You feel revved up. Your skin, again, doesn't feel right. Your hair doesn't seem right. Okay, so what's going on? 2 things. The first thing is iodine. You need iodine. Those purple dots on the thyroid hormone molecule, that is iodine. In 1924, the Morton Salt Company started marketing iodized salt to this girl with the umbrella on it. And suddenly, everyone was getting plenty of iodine. Nowadays, people have gotten kind of sophisticated. They're going to low salt diets, or they're having kosher salt, or they're having sea salt, or Himalayan salt that may not be iodized, and we might be running low on iodine. Now, the dairy industry will say, don't worry, we've got you covered. Dairy disinfectants have iodine in them. So when the teeth on a cow's udder are caked with manure or packed with dried milk or mud, they use a disinfectant that has iodine on it, and bits of the manure and disinfectant get into the milk. And so they say, hey, our product gives you a little iodine. True, but not the healthiest source. The healthiest source of iodine, actually, if you're not having iodized salt, is sea vegetables. Go to the sushi bar, don't have the fish sushi. Have the cucumber roll or the asparagus roll or the sweet potato roll. That nori seaweed wrapping is high in iodine. Or wakame, the little strips in your miso soup, or arame, which is used in Japanese salads. They have lots of iodine in a delightful, healthy way. The biggest reason for thyroid abnormalities in the US, though, is not a lack of iodine. It's antibodies, and doctors can measure these. So for some reason, your body is making antibodies not to attack a virus, but they're attacking you. Well, could foods somehow play a role in this? The Adventist Health Study 2 of almost 66,000 people looked at the prevalence of hypothyroidism, and they found that vegans, people who don't eat animal products, had the lowest prevalence, and lacto-ovo vegetarians had the highest prevalence. These are people who were not eating meat, but they were making up for it with cheese and yogurt and ice cream. For hyperthyroidism, similar pattern, except now vegans had a lot less risk. Omnivores, people eating meat and dairy and eggs, were at the highest risk. What we believe is happening is that animal proteins are mistaken by your immune system as foreign proteins, and your body makes antibodies to them. The antibodies end up attacking the thyroid gland and causing hypothyroidism, or they attack the regulatory machinery of the thyroid so it can't turn off, and you end up hyperthyroid. So in either way, what we believe is that when people avoid these foods, they're likely to be able to do better. We need more research in this area, but it's remarkable to see that individuals who have put it to work tend to be doing very, very much better, often getting off their medications. So let me just finish with these 4 simple words. The body can heal. If you cut your skin, a Band-Aid doesn't heal you. Within the DNA of your skin cells is the program for the skin to reconnect again, and the blood vessels that have been severed can join again too, and blood can flow again like normal. If you break your leg, a cast doesn't heal you. It just holds the bones still so that the DNA programming inside the tissues of your body can cause the body to rejoin again. However, if I keep picking at that cut, or if my cast is too loose so that the bones keep wiggling, my body never will heal. And if my disease is not a cut or a fracture, but if my disease is diabetes, and I never give my cells a chance to rid themselves of fat, my body will never heal. If my arteries are clogged, and I never stop consuming the foods that cause cholesterol levels to rise, my body will never heal. The healing power of the body is really good, but it's not perfect. If we fight it, it's just not going to work. What's my Band-Aid? What's my first aid? What's my powerful medication? It's fruits, it's grains, it's vegetables, it's legumes. Do take a supplement, vitamin B12. This is not optional. You need this. You need it for healthy nerves and healthy blood. You don't need much, 2.4 micrograms a day. It's in every multiple vitamin you ever took. And you'll also just find supplements at the store. Do take it. And if by now you're watching this and you're thinking, okay, doc, sounds like a good thing. I'll bet you I'd be healthier, but if I go vegan, I'm going to have to live in the garage. My family will divorce me. No one will ever invite me out to eat. Wait a minute. Let me show you how to start this diet. I've never seen anyone unable to do it. You take 2 steps. The first step is take 7 days and just check out the possibilities. What would I eat if I were vegan? Take a piece of paper and just fill in different meal possibilities. Okay, I got 7 days. Bran flakes with almond milk instead of cow's milk. I can have oatmeal. I could have, instead of pork sausage, I'll try the veggie sausage. Let's just see. Could I have pizza without cheese? Guess I could try it. Anyway, you discover that there are all kinds of cuisines that have foods that you'd like. Latin American beans and rice, and veggie fajitas and bean burritos, or Italian, pasta fagioli, angel hair pasta with an arrabbiata sauce, or Chinese rice, vegetables, tofu dishes. Go to the sushi bar and have the cucumber rolls, or the sweet potato rolls, or the edamame. If you're going to Subway or Taco Bell, not really the pinnacle of culinary art, but they have meatless, cheeseless options. You can give them a try. After a week, you'll have all kinds of things on your list. Now, step 2, take the next 3 weeks, eat those foods. Do a 3-week test drive. At the end of 3 weeks, you'll discover you are physically healthier, you're losing weight, your blood sugar is better, your digestion is better, you're feeling good, but you also discover that your attitudes about foods have changed. You've discovered that a lot of people are on this journey with you, and you're seeing there are books and programs of all kinds and cool new products at the store, and you're going to discover you don't want to go back. Let me encourage you to try our 21-day Vegan Kickstart app. It's on your iPhone, it's on your Android, and it is free, and it's in English. It's in Spanish too, if you want to try that version. And this is my book, Your Body in Balance. I wrote this book because I wanted everyone to know about this power that they have. The first part is all about sex hormones, the things we've been talking about today, including menopause, which I didn't talk about too much, but please look at that chapter if that's your issue. Part 2 is all about metabolic issues, including skin and hair and moodiness and so forth. And part 3 is putting it to work, a healthy diet, and also how to avoid those occasional environmental chemicals that are not so healthy for us. I've got lots of recipes for you that you're going to love. They were all done by Lindsay S. Nixon. Delicious, easy to prepare. My hope is that people will see the old-fashioned approach, we can do better. It's not just that foods cause weight gain or high cholesterol or diabetes, but if I'm more sophisticated, foods can control my hormones. And that gives me control that I never had before over weight and diabetes and a huge range of things that I thought were out of control. And that's the idea. So let me ask you to help me spread the word. I hope that you found this useful, something good to learn about. Let me encourage you to connect as much as you can with others. And I have to say, where you are the experts at it. And then share this information. Social media gives us so much power to do it. Let's grab that social media megaphone and let's share this information far and wide. Recipes, food ideas, food information. Let's see what we can do to change the world. Thank you for letting me share this time with you.
Doctor, thank you very, very much. That was a wonderful presentation.
Thank you.
I have a few questions that I'd like to share with you that I'm sure everybody in the audience will be interested in your answers. You started the presentation talking about COVID. Would you give us your best estimate about if you roll the calendar forward, say 6 to 9 months, where are we, say by the end of March of 2021? What's it going to look like in our states, our counties, and our communities that's different from today?
Look around at the walls that are in the room you're in now. It's going to look a lot like that. Here's where we are. Obviously, nobody really knows for sure. But remember where we were back in March. It was coming in, and we were all hopeful maybe 3-4 weeks. We're going to have this, we're going to lock down for a little while, but by Easter, we'll be back in the malls. We're going to be, and a vaccine will come. And of course, that hasn't transpired. Nothing like that has occurred. So the virus is going to continue. As I mentioned earlier, the vast majority of people have not yet been infected, so it'll gradually work its way through the population. A vaccine would be a game changer. And there are more than 100 candidate vaccines in the works. We have to hope that one will emerge. Certainly candidates will emerge and they will be tested. The safety testing and the efficacy testing will take time, and then to produce it will take more time. So I personally have to say that I do not expect a vaccine to be available for anybody's use anytime in this calendar year or even early next year. I hope that I'm wrong, but I think that's the case. And I have to say something slightly more worrisome. Back in 1918, when the influenza vaccine came, but it never left. It reassorts and mutates so that every season you get a new form. So you need a new influenza vaccine, and very often they guess wrong. With this coronavirus, the possibility of reassortment to new variants against which we have absolutely no immunity and which could be more pathogenic, that's a very real possibility. Several things have to be done. We have to shut down the live animal markets. Right now, there are more than 80 of them in New York alone. They have to be shut down worldwide. To the extent that people go on plant-based diets, they will be able to avoid the viruses that come from animals. Animals are the vectors for influenza viruses and also coronaviruses. And to the extent that we don't invite animals into our farms and so forth and eat beans instead, we're going to be a lot safer. And then we have to eat as if the virus may come. And that means to eat the healthy plant-based diet that tackles obesity and diabetes and hypertension to the extent that's possible.
Do you still feel strongly that masks and 6-foot separation are effective preventers?
They're not fully effective. When people put on a mask, a typical mask that people have is largely effective. But people also discover as they're wearing it, they can't breathe very well. So they sort of adjust it around their nose, so they're kind of breathing around it. And then they take it off at first, every opportunity. And so they're not fully effective. There is an active debate as to the extent to which the virus can persist in the air. For example, you get on the elevator and somebody else was on that 10 minutes ago. Is the virus still circulating? The best guess is that while that is possible, that it probably is not likely. And so it's probably more the large droplets that do fall to the ground within just a matter of seconds. So what that really means is that masks and distancing are still good bets, but they are never fully effective.
Okay. One of the things that we talk to people about all the time is the doctors that we follow. And as I was thinking about this the other day and talking to some of our folks, I was forming a question in my mind. I go something like this. Since nutrition is not well taught in med school, and if somebody said, well, who are the doctors that you follow? We would certainly say Neal Banard was certainly one of them. But let's assume, just for the sake of discussion, there's 20 or 24 doctors that are the primary people whose books we read, whose conferences we go to hear them speak, and so forth. Where did they learn about the power of whole food plant-based and all of its health advantages? And essentially, was it an evolution from where they started? Or did they somehow learn from each other? Where did these people learn about health through whole food plant-based?
When the Physicians Committee began, it was 1985, and so much of the work that we've discussed now was not done at that time. However, we did have other work that was good. For example, the Framingham Heart Study had found, starting in 1948 and 1949, that people who had high cholesterol levels were at higher risk for heart disease. And we already knew that cholesterol was only found in animal products. And we also knew that animal fat raised cholesterol. So even from those findings, we knew that a plant-based diet was going to be the way to go. What teams like ours have been doing is refining that, understanding the mechanisms, and looking at the applications of it to a variety of diseases, making sure that we know what the best diet is, and then finding novel ways for people to apply it so that they really enjoy it.
I read a quote attributed to you regarding PCRM, and the quote was, "Along the way, I became convinced that in medicine, we don't do nearly enough to prevent illness. We wait until a heart attack comes through the emergency room door. So I set up the Physicians Committee for Responsible Medicine because I wanted doctors to emphasize preventive medicine and nutrition and good health rather than just waiting for people to get sick." You then recently put out a little search engine where people could go to different states and try to see if there were doctors who think like they do, if you would. So my question is, how many plant-based or vegan medical professionals are currently members of PCRM? And when do you expect to have really good coverage someday in all 50 states? And we'll say starting with South Carolina.
Right. We have about 12,000 physicians who belong to our group, but they're not all necessarily practicing this kind of medicine. They may be surgeons, or they may be psychiatrists or something who may or may not be involved in this. However, that said, we have a couple of things to let people know about. One is we have a program called Find a Doctor, and you go to PCRM, healthiest.org/find-a-doctor. And you'll see, we only just unveiled this about a week or two ago, and you'll see more and more doctors and other caregivers are putting their names up there, and you can follow them. Also, at the Barnard Medical Center here, we have a telemedicine program, which we launched before COVID, but since COVID, we've been really expanding it a lot. It doesn't currently apply to the Carolinas, I'm sorry to say, but I'm hoping that that will change in the near future. But we'd be more than happy to see people when all of this COVID madness ends. If people would like to drive up and see us here in Washington, D.C., we'd be more than happy to see you.
Okay. Now for the question that never seems to go away. Olive oil. And we heard what you said tonight about that. This is a topic that simply, it doesn't go away because anybody, if someone didn't know anything about eating healthy and went on Google and simply typed in, is olive oil or Evo, extra virgin olive oil, healthy for me? The answers they get would not be the answers we would give to people. So the question that I always wonder about here and discuss with some of our members is, there is a scientific community, I suppose, that has one consensus, if you would, and that is that these are healthy foods and can also be heart positive. And then there's our doctors who say, oh, no, it's not. So let me ask you one more time. Is olive oil or Evo, extra virgin olive oil, healthy for you or not? And this Predamid study that was quoted to us, what do you think of the study and how does it dovetail with your answer?
Okay, the Predamid study was a good study. It was done in Spain, had more than 7,000 people. They were at high risk for heart disease. They were almost all overweight. And some of them went on a Mediterranean diet, plus olive oil, where they gave them every week a bottle of olive oil. They said, don't cook with butter, cook with olive oil. Another group did the same diet, but instead of olive oil, they got nuts. And they said, use nuts because they taste good and it's healthy fat. And then they had a control group. And what they showed was that there was a modest reduction in the risk of cardiovascular diseases in both the nut group and the olive oil group. So that's a good finding. And here's what you could say in favor of olive oil. It's not chicken fat. It's a lot better than chicken fat. Chicken fat, beef fat, all fats are mixtures. And in that mixture of fats that makes up the chicken fat, the part that we're really nervous about is the saturated fat component. That's the part that raises cholesterol. That's the part that's linked to Alzheimer's disease. For chicken fat, it's about 30% saturated fat. That's terrible. So olive oil, only about 14%. So if you're cooking with chicken fat or bacon fat or beef fat, which are even worse, you're giving yourself a lot of saturated fat. If you switch to olive oil, it's much better. So why do people say not to use it? Because if I buy a nonstick pan and I'm not sauteing in any kind of grease, I'm skipping even that 14% fat. That's the first thing. So it's lower in saturated fat. So a switch from chicken fat to olive oil, great. A switch from olive oil to nothing, even better. The other thing is in the Predamid study, the weight loss in these overweight people was minuscule. They really didn't lose weight. And why is that? Because olive oil has just as many calories as lard. All fats and oils have 9 calories in every gram, and if you're packing a lot of it into your routine, it's hard to lose weight. So olive oil, I think it's great in many ways compared to animal fats. And if you're at an Italian restaurant, there's a little bit happens to drip on one of your angel hair pasta noodles, I wouldn't worry too much. That said, if you're trying to reverse a weight problem, if you're trying to tackle heart disease or diabetes, or if you're a young woman with cramps, you got to get not just the animal products out, you got to get the oil out too. And if you do that, you'll be successful.
Where do you stand on fish? Why is fish such a no-no with a plant-based diet?
Well, it's kind of like with olive oil, that fish has salmon, for example. If you get some Chinook salmon, unlike beef and chicken, it has some of its fat is in the omega-3 form, which is a healthy fat. So that's all good. The problem is that most of the fat in fish is not omega-3. It's not a healthy fat at all. In fact, the amount of saturated fat in Chinook salmon is about the same as the amount of saturated fat in beef. The amount of cholesterol is the same. So if you're eating fish, you're eating striated muscle. It's very much like the striated muscle in a cow or in a chicken. It's not broccoli, that's for sure. So people who are trying to tackle their diabetes or tackle their weight problems, those who are eating salmon or other fish, you discover over time, they really don't have the success that people who avoid the animal products altogether do.
One of the other topics that we constantly discuss is B12. And this is sort of a three-part question with the B12. First, how prevalent do you believe B12 deficiency is in our country? And more specifically, to people who follow a whole food plant-based diet. Secondly, do you think that our club members who follow a whole food plant-based lifestyle should be requesting a B12 blood test from their doctors? And thirdly, if we do request a blood test, you would hope that Medicare would cover the cost of doing that. And apparently, if someone had told me that if a doctor knows that that the person requesting follows a vegan or a whole food plant-based diet, there is a code that they can use to cover the cost of that. Are you familiar with that? So those are the three.
Yes. Okay, those are all great questions. The first thing to say is maybe what is B12 for people who are new to this. Vitamin B12 is a vitamin that you need in tiny amounts for healthy nerves and healthy blood. And it's a funny vitamin. It's not made by plants and it's not made by animals. It's not made by either one. It's made by bacteria. And the belief that some people have expressed is that the traces of bacteria in the soil or on plants or on our fingers or in our mouths would create the tiny amount that you need, the 2.4 micrograms a day that you need. And the idea is that modern hygiene has unfortunately eliminated all of those sources. Maybe. Meat eaters will get some B12 because in a cow's digestive tract, there are bacteria that produce B12, and so you'll get some of it in dairy, some of it in meat. But then you get cholesterol and all kinds of estrogens and all kinds of stuff you don't want. So the healthiest thing is to take a supplement, and that's the way to go. However, so that's not optional. If you're on a vegan diet, you've got to take a supplement or use fortified foods. But the best thing is to just go to the store, get the smallest supplement they sell, and take it every day. However, if you go into a hematology clinic, most of the people in that clinic who are low in B12 aren't vegan. Something's happened so that they're not absorbing B12 very well. And that's either because they have diabetes and they're on metformin, or they're on an acid blocker, or they've got a digestive issue, or they're over age 50 and they're not making much stomach acid anymore. All these things cause the absorption of B12 to go way down. So your first question is, how common is it? Among non-vegans, among just omnivores, as many as about 1 in 5 people is sort of marginal in their B12 blood levels. So it's very, very common. I encourage everybody to take B12, no matter, I don't care who they are. Don't take a lot. You should not overdose on these things. Take the smallest amount that they sell at the store. Should you get a blood test? Probably not. If you're taking it every day, you should be fine, unless for whatever reason you're symptomatic, then you can. But what you said is right, that typically Medicare does not pay for the test. And so that's why doctors are creative. Medicare will pay for it if there's a clinical indication. And you're showing up and asking for it doesn't count. So the doctor will write a diagnosis of, I want to rule out anemia, or they come up with some other diagnostic reason, they send that in, and then Medicare pays for it.
Do you have a preference in terms of the type of B12 supplement you take, whether it's cyanocobalamin or methylcobalamin?
No, they're both effective. They're both effective. The physiologic form is methylcobalamin. A lot of manufacturers use the cyanocobalamin. My understanding is they do it for shelf life. And it sounds frightening because it's got a cyanide molecule in it. The amount that is used is minuscule and has no health effect. So they're both effective. They both raise B12 blood levels quite well.
One of the things that I saw on your website from PCRM, you probably spend a good deal of time on Capitol Hill. And a few months ago, did PCRM, what kind of progress did PCRM make with the White House COVID-19 task force in advancing a whole food plant-based diet for improved health among our populace?
I have to say we've been really struggling, and not just with the White House, but frankly with every policymaking body right now. Everyone agrees that COVID-19 is far worse in people who have underlying conditions, obesity, diabetes, hypertension. However, where we have not gained traction is convincing policymakers to say, well, maybe before people get infected, if we're following a healthy diet, or even just getting your medications up to date, that would be a good thing to do. I have to say, even when a person has been in the hospital with a COVID diagnosis, if at that point you make sure that the person's diabetes is under the best control it can be, you're going to slash mortality. And so we wrote to the mayor of Washington, D.C. I'm going to get to the White House in a second. We wrote to the mayor of Washington, D.C. and said, here in Washington, we've got people dying every day. And it takes a particular toll among Black Washingtonians and Hispanic Washingtonians because they got a lot of diabetes and a lot of hypertension, among other issues. I mean, there are also systemic issues and access to care issues and so forth. And we've said, let us promote stop smoking so that we could survive a respiratory illness. Don't vape. Get our medications right up to date. So if my blood pressure is high, bring it down. If my blood sugar is high, bring it down, and promote a plant-based diet, which is the safest way to do all these things. And I have to say, it's been totally radio silence. And the medical societies of DC, of Baltimore, of Atlanta, have all been doing exactly the same thing, pushing their cities to try to deal with this. But I guess it's understandable. The city governments are so distracted by getting PPE and all of these other issues that the whole idea of eating in a healthful way to strengthen your body has gone way down. So with the White House has a task force, which has, of course, been very controversial. But the one point that we weighed in on is we said there was no member of that task force who is an expert in the underlying conditions. They got epidemiologists and virologists and so forth, but nobody who is a real expert in diabetes or hypertension or obesity. We said, put somebody like that on the task force so that we can have useful information to the public. People may not listen, but some will. Let's take advantage of it. And we went and appealed to the Surgeon General, who's a nice guy, and to the task force and to the vice president who's running it. And I have to say, they just do not have, they have not given any attention to this issue, and I hope that will change.
Have you ever had the opportunity to talk to Dr. Fauci about this subject?
Dr. Fauci, I think, is a very reasonable guy, and I think he's right about all of this. Unfortunately, I think his focus has been on the virus, containing the virus, and not the underlying conditions. And that's why I think he has got to play a central role, because he knows more about viruses than anybody. He's got his finger on the pulse. But you also need to bring in the endocrinologists. That's where diabetes is. Bring in the cardiologists. Those are people dealing with hypertension. And particularly people like my good friend Kim Williams, who you know, who is a cardiologist, who has been saying, if we're going to tackle this, we've got to use plant-based diets. Put those great minds together. If we do that, then everybody's agenda can be satisfied. The people who want to save lives have a better chance of doing that. The people who want to open the schools and people who want to open businesses, to the extent that people have more resilience and that we can tackle the death toll of this virus, we're going to be miles ahead. So that's a discussion that we are still having. We're not done yet. One thing about it is that we're very persistent. And I want to thank you for helping me get the word out, because it's absolutely life-saving.
Three more questions and I'll let you go. And
Yep.
Thank you very much. And we absolutely support what you're doing. Hypothyroidism. If hypothyroidism is considered an autoimmune disease, is it not best to avoid foods that are made from gluten?
Great question. For people who don't know what we're talking about, gluten is a protein. It's in wheat products. It's also in rye, and it's in barley. And for most people, it's healthy. They do well. It's a good source of protein. But about 1 in 100, not quite 1 in 100, people react very badly to gluten. It really rips them up. And maybe as many as 1 in 10 just feels better without it. So the question is, if hypothyroidism or hyperthyroidism are autoimmune, could the protein gluten be one of the triggers for it? It's a perfectly good hypothesis, one that has not been tested. So my suggestion is if somebody's hypothyroid, and let's say you're taking your thyroid supplementation, go to your doctor and say, I'm going to change my diet. Would you monitor me and see if I can reduce my thyroid supplement use? Avoid animal products. And if you wish to get away from gluten, you can. And then as time goes on, you can try to tease apart which aspect of the diet is the one that causes the problem. For now, we don't know that gluten is an issue, but it's conceivable that it could be.
Staying with thyroid for a second, can Hashimoto be reversed? And if so, how does a person who even follows a plant-based lifestyle start to do that?
Yeah, Hashimoto is the form of hypothyroidism that's caused by an antibody attack, which is what I was describing earlier. And there have been a lot of people who have reversed their Hashimoto's with diet. But there are several things that we don't know. No one has ever done a randomized clinical trial of a plant-based diet or any other diet, to my knowledge, to see if it could cause Hashimoto's to go away. So what that means is it 1 in 50 people who's able to eliminate it, or is it 49 out of 50? We really don't know the answer to that, and won't until somebody does a good trial. But you shouldn't wait. What I would do is I would suggest that you talk to your endocrinologist and say, I want you to monitor me while I change my diet. And if you're not following a plant-based diet, now's the time to do it. If you are following a plant-based diet, what I would do is have it be as simple a diet as you can. Not a lot of processed stuff, beans, vegetables, whole grains, fruit. And if you want to go gluten-free for 3, 4, 5 months, something like that, you could give that a try too. Give it a good college try. And then your doctor can test you and see how you do.
Now, one of the things, because you said it 3 or 4 times, that I think shouldn't be lost on any of us, you said, tell your doctor you should be monitoring me as you make those changes. That is really, really important. Last question.
Well, let me emphasize that.
Yes.
Where that is really crucial. Let's say a person's got type 2 diabetes and you're treated with insulin. People are used to thinking of diet as not working very well. So somebody comes in and they come in here to our clinic and we say, we want to follow you, don't cancel your appointment, I want to see you next week. And they start a low-fat vegan diet and they think it's not going to be very powerful. And they're on 20 units of insulin a day. On about day 3 or day 4, they call me up at 6 o'clock in the morning and they say, I'm shaking, I'm sweating. And I say, I'm going to hold you on the phone. I want you to check your blood sugar right now. And they check their blood sugar and it's about 45. In other words, they didn't realize how powerful the diet was. And their blood sugar has been dropping. And they kept taking the medications from before without letting us bring them down. So if you're on medications for diabetes, if you're on medications for blood pressure, talk to your doctor and get your doctor's advice about backing off those medications in a sensible way, because the diet really is powerful. And the combination of the diet and the drugs can sometimes be too powerful if left alone. So yeah, don't cancel your doctor's appointment. Don't throw your pills in the trash either. Work together to get them on, to get off them in the right way.
Last question has to do with arthritis. This is from a member who's been plant-based for 18 months. And she said, I have both osteo and rheumatoid arthritis. I don't take any meds. What, if anything, can I do to improve my situation?
Okay, well, first of all, I'm sorry you're struggling with that. It can really be obviously annoying and limiting. Rheumatoid arthritis is an autoimmune condition. The same kind of thing I was describing with the thyroid, that if you could look at the synovial lining inside the joint, it's being attacked by antibodies. And the question is, could some food be causing that attack? Could that be triggering it? And you never know for a given individual, but there's a way to find out. And what you do is, if you haven't yet started a plant-based diet, do that. All vegan, all the time, keep oils low. Then, if that doesn't cause the pain to go away, I would suggest you do what's called an elimination diet. And the elimination diet is saying, there's something that might be triggering this. I'm going to take all the suspects out of my diet. And what you do is that you limit your diet to just what I call pain-safe foods. Those are things like rice, cooked vegetables, very few other things. So you can eat a full plate, but it's going to be very few foods filling up that plate. And then after a few weeks, if your arthritis settles down, after maybe 2-3 weeks, then you add foods back one at a time. So you took out citrus fruit, you bring it back. And over a 2-day period, you eat a lot of citrus to see if your joints flare up. And if they don't, you keep the citrus. Then you bring wheat back and you have spaghetti and bread over a couple days. And if your pain doesn't come back, you keep that. And you bring the foods back, but one at a time to see which one causes the pain. If it causes pain, stop it and avoid that food for the rest of your test. What you may find is that there are 2 or 3 foods that are triggers for you. And once you identify them, you avoid those foods. And for some people, their pain is gone forever. If you would like the details on this, I wrote about it in 2 different books. One was called The Cheese Trap, which came out a couple years ago, because cheese is one of the most addictive foods and one of the ones that contributes to a lot of health conditions. And in the back of The Cheese Trap, I wrote this formula for how to do this elimination diet. Have a look and you'll see it. And give it a good try and see what happens.
We will definitely do that. Dr. Barnard, it has been a pleasure for all of us to have you here with us tonight. And I want to also say to everyone who's listening, Dr. Barnard has allowed us to record the evening, and we will make it available both through Zoom, and we have a YouTube channel as well. So you can get access to all the wonderful information that was presented. Thank you for what you do. You stay healthy, because that's important to us as well. And we appreciate you being with us this evening.
Well, it's been very kind of you, and I appreciate all the good work that you've done. I have to say, in any given day, a doctor might see 15, 18, maybe 20 patients a day, but in the work that you do and with this program, you're reaching far more people than that. You'll never know how many lives you save, but I'm sure you'll save many. Let me also encourage people, if you're all wound up about this, go to YouTube and stop the evening the way we started it. Go to YouTube and look at the Carbon Works channel, and you'll see a picture of a couple of cats curled up together, and they're getting ready to go to sleep. Click on that link and listen to this little 2-minute lullaby and see if the stresses of this crazy time doesn't evaporate a little bit. We put this together for people who need a couple minutes of peace.
Would you spell the name of your group for everybody who's listening?
It's called Carbon Works, as in we are made of carbon, and these are our works. So CARBONWORKS. They're musicians from all around the world who have been friends of mine for a long time. And even when I was a medical student and with all the research we've done, I've always tried to take time to have a little fun, goof off, and that's what it's about.
Thank you very much, sir, and thank you to everybody who joined us this evening. We'll see you in a month.
Thank you, everybody.
Stay safe. Good night, and thank you again, Doctor.